a WikiVidi documentaries production. Don't forget to like and subscribe. Enjoy. Syphilis. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum subspecies pallidum. The signs and symptoms of syphilis vary depending on which of the 4 stages it presents. The primary stage classically presents with a single chancre, but there may be multiple sores. In secondary syphilis, a diffuse rash occurs, which frequently involves the palms of the hands and soles of the feet. There may also be sores in the mouth or vagina. In latent syphilis, which can last for years, there are few or no symptoms. In tertiary syphilis there are gummas, neurological, or heart symptoms. Syphilis has been known as the great imitator, as it may cause symptoms similar to many other diseases. Syphilis is most commonly spread through sexual activity. It may also be transmitted from mother to baby during pregnancy or at birth, resulting in congenital syphilis. Other human diseases caused by related Treponema pallidum subspecies include yaws, pinta, and bejel. Diagnosis is usually made by using blood tests. The bacteria can also be detected using dark field microscopy. The Center for Disease Control recommends all pregnant women be tested. The risk of sexual transmission of syphilis can be reduced by using a latex condom. Syphilis can be effectively treated with antibiotics. The preferred antibiotic for most cases is benzathine-benzyl penicillin injected into a muscle. In those who have a severe penicillin allergy, doxycycline or tetracycline may be used. In those with neurosyphilis, intravenous benzyl penicillin or ceftriaxone is recommended. During treatment, people may develop fever, headache, and muscle pains, a reaction known as Jarus-Herxheimer. In 2015, about 45.4 million people were infected with syphilis, with 6 million new cases. During 2015, it caused about 107,000 deaths, down from 202,000 in 1990. After decreasing dramatically with the availability of penicillin in the 1940s, rates of infection have increased since the turn of the millennium in many countries, often in combination with human immunodeficiency virus. This is believed to be partly due to increased promiscuity, prostitution, decreasing use of condoms, and unsafe sexual practices among men who have sex with men. In 2015, Cuba became the first country in the world to eliminate mother-to-child transmission of syphilis. Signs and symptoms. Syphilis can present in one of 4 different stages: primary, secondary, latent, and tertiary, and may also occur congenitally. It was referred to as the great imitator by Sir William Osler due to its varied presentations. Primary syphilis is typically acquired by direct sexual contact with the infectious lesions of another person. Approximately 3 to 90 days after the initial exposure, a skin lesion, called a chancre, appears at the point of contact. This is classically a single, firm, painless, non-etchy skin ulceration with a clean base and sharp borders 0.3–3.0 cm in size. The lesion may take on almost any form. In the classic form, it evolves from a macule to a papule and finally to an erosion or ulcer. Occasionally, multiple lesions may be present, with multiple lesions more common when co-infected with HIV. Lesions may be painful or tender, and they may occur in places other than the genitals. The most common location in women is the cervix, the penis in heterosexual men, and anally and rectally relatively commonly in men who have sex with men. Lymph node enlargement frequently occurs around the area of infection, occurring 7 to 10 days after chancre formation. The lesion may persist for 3 to 6 weeks without treatment. Secondary syphilis occurs approximately 4 to 10 weeks after the primary infection. While secondary disease is known for the many different ways it can manifest, symptoms most commonly involve the skin, mucous membranes, and lymph nodes. There may be a symmetrical, reddish-pink, non-etchy rash on the trunk and extremities, including the palms and soles. The rash may become maculopapular or pustular. It may form flat, broad, whitish, wart-like lesions known as condylomelalgium on mucous membranes. All of these lesions harbor bacteria and are infectious. Other symptoms may include fever, sore throat, malaise, weight loss, hair loss, and headache. Rare manifestations include liver inflammation, kidney disease, joint inflammation, periostitis, inflammation of the optic nerve, uveitis, and interstitial keratitis. The acute symptoms usually resolve after 3 to 6 weeks. About 25% of people may present with a recurrence of secondary symptoms. Many people who present with secondary syphilis do not report previously having had the classic chancre of primary syphilis. Latent. Latent syphilis is defined as having serologic proof of infection without symptoms of disease. It is further described as either early or late in the United States. The United Kingdom uses a cutoff of 2 years for early and late latent syphilis. Early latent syphilis may have a relapse of symptoms. Late latent syphilis is asymptomatic and not as contagious as early latent syphilis. Tertiary. Tertiary syphilis may occur approximately 3 to 15 years after the initial infection and may be divided into 3 different forms: gummas syphilis, late neurosyphilis, and cardiovascular syphilis. Without treatment, a third of infected people develop tertiary disease. People with tertiary syphilis are not infectious. Gummas syphilis, or late benign syphilis, usually occurs 1 to 46 years after the initial infection, with an average of 15 years. This stage is characterized by the formation of chronic gummas, which are soft, tumor-like balls of inflammation which may vary considerably in size. They typically affect the skin, bone, and liver, but can occur anywhere. Neurosyphilis refers to an infection involving the central nervous system. It may occur early, being either asymptomatic or in the form of syphilitic meningitis, or late as meningovascular syphilis, general paresis, or tabes dorsalis, which is associated with poor balance and lightning pains in the lower extremities. Late neurosyphilis typically occurs 4 to 25 years after the initial infection. Meningovascular syphilis typically presents with apathy and seizure, and general paresis with dementia and tabes dorsalis. Also, there may be Argyll-Robertson pupils, which are bilateral small pupils that constrict when the person focuses on near objects, but do not constrict when exposed to bright light. Cardiovascular syphilis usually occurs 10–30 years after the initial infection. The most common complication is syphilitic aortitis, which may result in aneurysm formation. Congenital. Congenital syphilis is that which is transmitted during pregnancy or during birth. 2/3 of syphilitic infants are born without symptoms. Common symptoms that develop over the first couple of years of life include enlargement of the liver and spleen, rash, fever, neurosyphilis, and lung inflammation. If untreated, late congenital syphilis may occur in 40%, including saddle nose deformation, Hegemanakis sign, saber shin, or Clutton's joints among others. Infection during pregnancy is also associated with miscarriage. Bacteriology. Treponema pallidum subspecies pallidum is a spiral-shaped, gram-negative, highly mobile bacterium. 3 other human diseases are caused by related Treponema pallidum subspecies, including yaws, pinta and bejel. Unlike subtype pallidum, they do not cause neurological disease. Humans are the only known natural reservoir for subspecies pallidum. It is unable to survive more than a few days without a host. This is due to its sudden small genome failing to encode the metabolic pathways necessary to make most of its macronutrients. It has a slow doubling time of greater than 30 hours. Transmission. Syphilis is transmitted primarily by sexual contact or during pregnancy from a mother to her fetus. The spirochete is able to pass through intact mucous membranes or compromised skin. It is thus transmissible by kissing near a lesion, as well as oral, vaginal, and anal sex. Approximately 30% to 60% of those exposed to primary or secondary syphilis will get the disease. Its infectivity is exemplified by the fact that an individual inoculated with only 57 organisms has a 50% chance of being infected. Most of new cases in the United States occur in men who have sex with men. Syphilis can be transmitted by blood products, but the risk is low due to blood testing in many countries. The risk of transmission from sharing needles appears limited. It is not generally possible to contract syphilis through toilet seats, daily activities, hot tubs, or sharing eating utensils or clothing. This is mainly because the bacteria die very quickly outside of the body, making transmission by objects extremely difficult. Diagnosis. Syphilis is difficult to diagnose clinically early in its presentation. Confirmation is either via blood tests or direct visual inspection using microscopy. Blood tests are more commonly used, as they are easier to perform. Diagnostic tests are unable to distinguish between the stages of the disease. Blood tests. Blood tests are divided into non-treponemal and treponemal tests. Non-treponemal tests are used initially, and include venereal disease research laboratory and rapid plasma reagent tests. False positives on the non-treponemal tests can occur with some viral infections, such as varicella and measles. False positives can also occur with lymphoma, tuberculosis, malaria, endocarditis, connective tissue disease, and pregnancy. Because of the possibility of false positives with non-treponemal tests, confirmation is required with a treponemal test, such as treponemal pallidum particle agglutination or fluorescent treponemal antibody absorption test. Treponemal antibody tests usually become positive 2 to 5 weeks after the initial infection. Neurosyphilis is diagnosed by finding high numbers of leukocytes and high protein levels in the cerebrospinal fluid in the setting of a known syphilis infection. Direct testing. Dark ground microscopy of serous fluid from a chancre may be used to make an immediate diagnosis. Hospitals do not always have equipment or experienced staff members, and testing must be done within 10 minutes of acquiring the sample. Sensitivity has been reported to be nearly 80%. Therefore, the test can only be used to confirm a diagnosis, but not to rule one out. 2 other tests can be carried out on a sample from the chancre: direct fluorescent antibody testing and nucleic acid amplification tests. Direct fluorescent testing uses antibodies tagged with fluorescein, which attach to specific syphilis proteins, while nucleic acid amplification uses techniques, such as the polymerase chain reaction, to detect the presence of specific syphilis genes. These tests are not as time-sensitive, as they do not require living bacteria to make the diagnosis. Vaccine. There is no vaccine effective for prevention. Several vaccines based on treponemal proteins reduce lesion development in an animal model, and research continues. Brought to you by WikiVidi documentaries. Would you like to know more?